mental health and substance abuse. They're issues that have been ignored for far too long, that we've kind of hidden, and I'm happy to see that they're finally at least coming out in the public, that people are talking about these very important issues. The suicide rates are soaring. Overdoses are occurring left and right, and it's something that does need to be addressed. Now, I want everyone to keep in mind something as they listen here. Last year, we had a gubernatorial forum. There was, I think, 12 candidates for governor up here talking. And one of the candidates, Dr. Andy McGuire, said something I thought that was really important. She said, if somebody walked through these doors and they had a broken arm or a broken leg, we would rush over to help them, right? What happens if somebody has a mental illness? What happens if they're suicidal, depressed? Are we going to know what warning signs to look for? Are we going to ignore it? What happens if they're a drug addict? Or are we going to go over there and help? And I think a lot of it's even knowing that there's a problem. A lot of times these issues are concealed. And that's the way it was for me. Now, a lot of the issues that, as I travel across Iowa and I get asked about, we discover they're really tied together. Whether it be the budget, prioritizing things in the budget, that's very important. Medicaid privatization, that's something that comes up. Criminal justice reform, mental health, the mental health facilities closing, all these things are tied together in some way. And so it's very important that whenever the Iowa poll came out, a lot of these issues you discovered that they are very well related. I'm going to talk a little bit more generally here, and we'll get more into policy as we go through the Q&A. And I'm going to stay solution-focused. I'm not going to talk bad about any of my opponents or anything that they've done or said or disagree in that way, because I think we almost work together. I think there's a time for working together. And I really want to thank Fred and Kim for being here. I think that's important. All three of us have went through things in our lives that we've had to overcome to be able to speak here today, that's for sure. There are three key points, though, that I want to hit upon: suicide, addiction, and bullying. So last year when we had the gubernatorial forum, I admitted something I had only told 5 to 10 people about properly. The question came up, I think it was Kathy that asked, what's the one thing, the most important thing it comes to address for mental health? And fortunately, I wasn't the first candidate, so I had a little bit of time to think. 12 candidates, I had time, I was in the middle. And the more I thought about this, I thought, what was the thing that could have helped me the most? And I decided, it's really the stigma surrounding mental health. The stigma surrounding any of these issues is the most important thing, that until we get past that, we cannot really, if we don't even know there's a problem, how can we solve it? If we're not willing to admit there's a problem, how can we solve it? So I made an admission, back in 2011, I contemplated suicide. Looking back at it, the issues that I was having at the time, they seemed disastrous, like it was the end, like there was no hope. Looking back on it, it seemed minor problems. But at the time, they were very real, very important, something that really caused me a lot of problem to the point that I was going to kill myself. I went for a drive. I had made my last calls, that I was going to make to my family, friends, people I cared about. They didn't know it was my last calls. And I went for that drive, and my next question was, how am I going to do this? Going to use a gun? Am I going to make it look like an accident? Am I going to take an overdose? How am I going to do it? Somewhere on that drive, fortunately it was a long enough drive, that just in a glimpse I had this spiritual experience, and I decided not to kill myself. Unfortunately, there's a lot of people that don't have that, and they end up going forward with it. And that's why I share that, because I think that we have to be able to share these stories, even though they're not comfortable, even though we don't want to, even though they aren't stuff we like to talk about. There's stuff that everyone goes through. Former Iowa Governor Hughes went through very similar circumstances that he wrote about in a book that I think inspired a lot of people. And it was reading his book that helped me come forward with my story. There's also things of stigma that, no, I haven't suffered with directly, but I know people that have. And one of those things is drug abuse. We need to end the stigma surrounding drug and alcohol addiction, illegal and legal drug addiction. We need to look at treating more of these issues as mental health issues, public health issues, and less as criminal issues. We have people that are afraid of seeking help in this state. They're afraid that if they admit they've got an addiction, kids might be taken away from them. They might lose their job. They might lose their economic opportunities for the rest of their lives. They might even go to jail. These are the very real questions that people have to ask. And we have treated these issues as solely a criminal issue, and I think it's done a real disservice to the people that have those addictions. It is, you know, as Fred pointed out, it costs, I think it was $32,000 a year. He said 30,000, I don't know, to put somebody in jail or prison per year in Iowa. It's a lot cheaper to treat the addiction and substance abuse issue than what it is to put somebody in jail. Putting people in jail for these crimes whenever maybe we don't have to tears apart families. It leads to long-term consequences for society. And I would like to see us not look at a drug addict and say you're necessarily a bad person, that maybe you've experienced stuff that other people, that no one should have to experience in life. And that we should look at them with the same dignity and respect that we would like to be looked with. And then the last point I wanted to get was into bullying. Let's not insult others. Let's not make fun of people who do suffer from these issues. Let's not do that. And I think politicians can definitely learn from this right here, myself included. You know, it was Rumi, the Sufi mystic, that once said, yesterday I was clever, so I tried to change the world. Today I am wise, I am changing myself. I'm not always wise, I'll admit that, but I'm going to try to be wise today. We need to set a good example. Whenever you turn on the TV, this is one of the reasons why I got rid of the TV. What do you see, though? You see negative attack ads, people attacking one another. You turn on the news. It's all opinion. No one willing to work together. No one willing to address the issues. It's all back and forth partisan BS that doesn't resolve anything. We may not always agree on the solutions. We may not always agree on the solutions. That's okay, but we have to extend and work with other people. And I find one of the most hypocritical things, we've got politicians telling children not to bully. We're going to pass legislation against bullying, and what do? They bully one another. That's not good leadership. And so, you know, there's times that I get angry and I say things when I shouldn't. Like over the debate access, I think, Kathy, we probably went back and forth on that a little bit, off and on, but that's not good leadership, though, for me doing that. And we need to admit that, and we need to work together with people, even when we don't necessarily see eye to eye. And so that is what I wanted to say, and I'm happy to get right into questions and answers.
All right. Thank you.